you see it?
Yes, yeah.
Perfect, great. So, well, welcome everyone to tonight's session, and thank you very much for joining us. As Ryan said, my name is Marga. I am a technical vet with Audevard, and I've been with the company for the past 6 months. So before, I had been an equine vet for 6 years in the UK and in Belgium. And I recently joined Audevard to just provide technical support and answer questions. So both to vets such as Ryan and team, and also to horse owners that are our end customers for our products. So I would just like to start by giving you a little bit of a background on our brand and a bit of like the core values and the vision and the mission that we have. So Audevard is a French laboratory company, and we specialize in drugs and also nutraceuticals or supplements for horses. And our sort of vision or our main core values would be to produce supplements that are efficient, that are safe to use in your horses, and that are convenient, so that we provide you real solutions for your horse's needs and also their evolving needs, so that you may be able to adapt what you're doing with your horse to their demands. We also have a vision for always keeping innovating our formulas and our products, just to stay in line with the current science and the current evidence that we want to be up to speed with, just with the end goal of providing really high quality premium equine supplements that you really know that you are getting what it says on the tin, and that what it says on the tin is there because we want it to be there, because there is a science background to those ingredients. And essentially we do that by incorporating vets such as myself and my colleagues on the vet technical team. We spend quite a lot of our time just researching the ingredients, researching the formulations, and also listening to the market. So we also listen to what horse owners, trainers, riders, etc., and also vets expect from us as a company, and how we can better help them and help their patients or their horses to perform better and just to improve overall welfare. So we have a commitment to gradually eliminate animal byproducts in our range of supplements. So gradually you will not see any more animal origin ingredients in our range. So we are going to see one product already tonight where we've made a big move in that direction. And we also commit to transparency and titration. So all our formulas are free from any contaminants, and we have an independent lab in France testing for that to make sure that everything is correct. And there will always be a PDF with the batch testing available on our website for all our products. And finally, we also display what we call the ADP logo, which is this blue tick that you can see on the right hand side of the slide. It basically refers to that the product has been tested and it's proven to be free from any doping ingredients. If the product is not free from any doping ingredients, then the horse can have still that product, but you will have a different ADP logo with either a number of hours or a number of maximum doses for the horse to have before competition. So we will see a little bit more on that with a couple of examples. So if we start today, I think a good place to start talking about these, and especially given also the results of the poll where the majority of you would use joint supplements, we need to remember a couple of key facts about musculoskeletal problems, also not only in older horses but in the general horse population. So musculoskeletal problems are the #1 cause of lameness and early retirement in horses, and in fact osteoarthritis, so joint disease, it's highly prevalent, so it's highly frequent in horses. So up to 35% of them will develop arthritis or degenerative joint disease over time. And we know from studies that this doesn't only happen to domestic horses but also horses in the wild. So obviously lameness will be the most common cause of loss of use in horses, a major factor that can affect their athletic potential, but also their welfare, because when this becomes really chronic and the joints become really sore, the horse's welfare gets compromised, obviously, and this is a major concern for vets. Lameness is also the most significant factor to loss of training days. So horses getting lame and not being able to train or even compete, obviously, it's a major downfall of this type of issues. And we know here in the UK, about 20%, so 1 in 5 horses, are seen at least once a year by a vet because of lameness. Now, what happens if we center on our older horse population? So these are the results of 2 studies where they basically looked at how much lameness was prevalent in an old horse population. So at the top, on the top row, we have the study of 69 horses that were 30 years or older, so pretty advanced age. And the researchers in this study, they found that 77% of these horses were lame, and up to 97% had reduced range of motion, so basically a very stiff joint on at least one joint in their body. And then the same group of researchers asked themselves the question, so what happens if we bring the age a little bit lower? So if we consider 15 years old, that's more of an average age for our horse population. Well, they recruited 200 horses of 15 years old or around that age, and they found that half of them were lame, with 84% having reduced range of motion, that stiff joint, in at least one joint. And what's really interesting from this study is that they also reported that only 23% of the owners of those half of the horses that were lame knew that the horses were lame, actually. So this can be a whack in what it may come very insidious. So at the bottom here on this slide, you basically have some radiographs of the hock of the horse, and the black arrows point you towards classical findings of arthritis or joint disease in this area. So as a summary, and with a particular focus with arthritis, of course, musculoskeletal disease in aged horses is the most prevalent health and welfare issue, with arthritis and chronic laminitis being the most common single disorders. And we really need to get on top of it, because at the end of the day is the main reason why horses are put to sleep prematurely or even at the end of their lives, is usually the determining factor. We also need to remember that the back can also suffer from osteoarthritis. So it's not, sometimes we refer to back problems as what we call referred problems, because the horse may have a stiffer back because they have a problem in one of the legs and they are just basically getting into spasm because they are trying to compensate. But the back itself can develop arthritis or joint disease in the joints in the back. So this is something that's also worth considering, and that will add up, especially if the horse also has joint disease in one of the legs. So the first supplement that I would like to talk to you about is Equiflex Arthro Evo, and this is our sort of main product in terms of providing joint protection and support for that daily wear and tear. Now, daily wear and tear is usually, as we know, that what leads to joint disease, just because there is like progressive breakdown and progressive damage that happens inside of the joint. And this product specifically is designed to provide nutrients and also help improve the repair process against that daily wear and tear that will gradually lead to the joint disease. This is actually an update on our previous formulation, which some of you may or may not be familiar with, was Equiflex Arthro. The Equiflex Arthro Evo is the first chondroprotective, so joint protection, formula for horses that is 100% plant-based. So we got rid of any animal origin ingredients, and we've also tried to keep as many ingredients as possible of a plant-based origin, and where that wasn't possible, just a synthetic or origin, or basically a non-animal derivative. So the main things to remember about this product, and just to help you understand a little bit better how it works, is we are not only taking care of the cartilage and the joint fluid, but we're also taking care of the subchondral bone. Now, these are all a bit of a mouthful, but let me explain. So the cartilage is the layer that recovers the bone at its end, where it meets another bone in a joint. So the cartilage has to be a very smooth and hydrated, so plump surface to cushion the bone when it gets in contact with another bone in a joint. And then we also have the joint fluid, which is the fluid that is within the joint that just sort of lubricates the movement of bone against bone, and it makes them glide together really nicely and avoid clicks and clacks, and also the pain and the stiffness that arises when the bone is basically not moving together against each other. But then we have a third actor, which is the subchondral bone. And the subchondral bone is basically the end of the bone just beneath the cartilage. And why is this important? Because that end of the bone has particular properties that means that that provides nutritional, so it drives nutrition into the cartilage, and also mechanical support. So it basically allows the bone to adapt to the different forces. So it's really is actually a component of the joint, but it had sort of like maybe a little bit been forgotten. But we know from human research that it gets damaged when there is joint disease, and actually stopping and slowing down that damage is really important also in horses. So what we try to do with when updating the Equiflex Arthro formula is to incorporate an ingredient that we call PAC, that is a derivative of grape seeds and grape skin extract to protect that subchondral bone as the third effector of joint health. Then we've also included glucosamine, which we know is essential for joint nutrition. We've also included peptogen, which is a precursor of collagen that is our own patented ingredient, and we've made it exactly to the same composition of the collagen in the horse's joints. So the horses recognize that peptogen or that collagen precursor as their own, and they uptake it straight away into their joints for repairing and providing more nutrition to that wear and tear of the joint. We also have ASU, which are basically phytosterols or fat derivatives of avocado and soy. So again, plant-based origin that are proven to have beneficial effects on protecting the joint against damage. And we also have an antioxidant, which is MSM, that also nourishes the cartilage at a very deep level. So this again would be, Equiflex Arthro Evo would be your ongoing support. So if your horse has some stiffness, it has been diagnosed with joint disease in the past, this is a very good supplement to stay on long term to just offset the damage from the daily activities. If we move now on to Equiflex Monologues, this would be more of a product with a target to improving recovery and supporting the horse at the times when they may be a little bit sore. So remember that sore back that we said, it can be because it's sore in itself because there is arthritis of the back, but it can also be sore because the horse is compensating its movement because one of the legs is hurting or he's lame on one of the legs. So Equiflex Monologues would be a very good product for that because it has a combination of ingredients that provide relief without having the adverse effects of standard or drug medication. So it has white willow, which is actually the precursor of salicylin, and salicylin is at the same time the precursor of aspirin, of the active ingredient in aspirin. So it provides that relief, that it offsets that inflammation, and it just helps the horse overcome that soreness, and it can also shorten the recovery period in between training sessions. So it's a good product as it stands on its own, but it's also a good complement to Arthro Evo if the horse has a period where he's a little bit more sore, training a little bit more intensively, etc. The horse could come off that Arthro Evo and go on Monologues for a period of time to just help that relief and recovery. We have a pellet and we also have a paste. So the paste is very convenient to use on the go. And what's important to know is whilst Arthro Evo was completely free from doping ingredients, For Monologues, if your horse is to compete and it could be tested, you can only give a maximum of six scoops on the day prior to competition. But that's quite a lot of those actually. So if the horse is not competing, there is no issue. If the horse is competing, we just need to be careful with that. So now moving on to tendons and ligaments. So we are still on that musculoskeletal issues topic. Is the second most frequent issue in horses after 15 years of age. So tendon and ligament problems. And what we need to remember about these, especially in older horses, is that the tendons and the ligaments are degenerating, so there is damage going on, but also those horses, just because of their age, they have delayed healing capacity. So any injury will take longer to heal than in a younger horse. So it will all depend on how severe, so how bad is the injury, whether it has happened in the past, whether there is associated joint damage as well. And all of these factors are going to impact how the horse will be able to return to activity if it does a tendon or a ligament. One particular problem I would like to speak about is what we call degenerative suspensory ligament Laminitis. So the suspensory ligament runs at the back of the horse's legs, and it's very important to sort of cushion the movement. What happens in this problem is that the suspensory ligament basically breaks down at the top. So there is a drop in the fetlock because there is no tension holding that fetlock upright anymore. So we will classically see that fetlock drop. Why is this important? Because this is a classical feature. It doesn't always happen, but most of the horses that present with these is because they have underlying PPID, which is what we commonly call Cushing's disease in horses, especially if the Cushing's has not been detected prior and the horse is not on medication, so it's not being controlled. Now, in these cases, it's very important to detect the Cushing's early and start medication, even though this tends to be a chronic problem. And because the damage is already done by the time that we see the drop in the fetlock, the prognosis for any athletic or even ridden activity is quite poor. However, the horse can still be kept comfortable. And obviously, if we control the Cushing's, then that's definitely also improving the prognosis and the life expectancy. On that note about the tendon and ligament, we have Equiflex Tendon, which is another Equiflex range product, and this time is more focused, is similarly to Arthro Evo, was aimed at supporting and preventing further damage in the joints. Equiflex Tendon is supporting and preventing further disease in the tendons and ligaments. So it's especially designed for active horses. However, if your horse is not that active, but it has suffered a tendon or ligament injury, this would definitely be super indicated. Also, horses that have gone for surgery for a tendon or a ligament during their recovery period. And why is that? Because the combination of ingredients in Equiflex Tendon is especially designed to promote the healing of those tendons and ligaments, but not forming scar tissue, but actually forming functional, flexible, strong tendon and ligament fibers. So we are not only just sort of repairing the tissue in a scar tissue that tends to be stiff and not as strong, but actually functional tendon and ligaments fibers. Now we're going to talk about the dreaded L word, and I'm pretty sure everyone knows what I'm going to talk about. So laminitis is obviously really well known because sadly it accounts for over 7% of equine deaths in the UK. So 7% of horses being put to sleep, it's because of laminitis, regardless of the stage. So just as a refresher, here we have an example of the 3 different stages that we can find. So non-laminitic or a healthy hoof on the left. Then we have the start of the laminitis, where the picture is not super, but you can see that the tip of the pedal bone is starting to separate from the hoof wall, as pointed on with yellow arrows. And then we have what we call rotation. So basically the angle of the pedal bone, it's starting to really be really upright against the hoof. So that's a hoof at the end stage. So why is this important? What we need to know is laminitis, it's a very complex disease. So it can be caused by what we call systemic disease. So the horse basically becomes very ill. And then the laminitis develops. So this could be because there is a hormonal imbalance, so PPID, Cushing's, or also equine metabolic syndrome. We know that these horses are super predisposed to developing laminitis. But also if the horse has an inflammatory disease. So for example, a really bad colic, diarrhea, a broodmare when they develop infections of the womb, etc. They can develop laminitis just because of all the toxins circulating in the bloodstream. The other type of laminitis, which is fairly less common, is what we call mechanical overload. And this is laminitis that typically only affects one leg, and this is because the other leg is injured, so not functional for whatever reason, and there may be a fracture or an abscess, etc., and the horse is overloading the other leg. So the overloaded leg develops laminitis because of the excess weight. Regardless of the cause of the laminitis, we need to understand that we have three pillars of managing and making these horses feel better. First and foremost is pain relief. We really need to get on top of that and stop that stress and pain cycle. Obviously, treating the underlying disease. So if the horse has Cushing's or equine metabolic syndrome, we need to get on top of that. If the horse is ill, we also need to do our best to make him better. Second step would be diet changes, strict box rest, and trusting and working together with your vet to get your horse better. And also working really closely with your farrier. So providing good foot support, remedial farriery, that will be different depending on the case. Some horses will do better with the different types of shoeing, etc. And also very deep bedding and management, lots of TLC. What else can we do? So we can also work on the nutraceutical side to provide additional support and relief. And this is where Harpagil, which is one of our most popular products, comes in hand. So Harpagil is a very concentrated product in harpagosides, which are the active ingredient in devil's claw. And what these harpagosides do is they basically interfere with the development of inflammation. So we know that laminitis involves a huge deal of inflammation in the horse's hoof, so and also at the whole body level. So Harpagil works really well to just reduce that overall inflammation and just soreness and stiffness. So it also incorporates a source of essential fatty acids, which we know also contribute to offset that inflammation. So it's a very good product to complement the medical pain relief in horses that are acutely suffering. And because of the devil's claw, so because of the harpagoside, it has a withdrawal time, so of a time that you need to stop giving the product before competition, of 48 hours. So if your horse was, you were using this product because the horse is sore for whatever reason, but still able to compete, then you should take it off 48 hours. Obviously, a horse with laminitis is sadly very far from any exercise activity, so there is no restrictions on that point. And finally, just to wrap up the musculoskeletal problems, we have all these huge list of hoof problems that are super common actually as well. Some of them are more like infections type of diseases, and in these cases, again, especially in older horses, we need to ask the question, could my horse have Cushing's? And that's why it's having chronic infections and also overall poor hoof quality, and most importantly, that impaired healing capacity. So all of these should ring the bell to horse owners and vets for testing for PPID or Cushing's. Then we have the more structural damage type of issues, and those, sadly, they don't have really an age preference, but they can develop in older horses regardless. Often they need surgery, but in any case, we have a long-term management issue to deal with. So why is this important? Because in all cases, whether the horse needs help in healing or is also just something that it will just take time to heal itself, Extra nutrition will be brilliant, and this is where Hoof Biotin comes in. So we would have a product that is super concentrated in D-biotin, which is a very active form of biotin, so very easy for the horse to incorporate in the hoof tissue. So if your horse has had a massive abscess dug out and there is a big chunk of hoof that needs to regrow and fill again that hole, that's a really, really good supplement. When the horse has had really aggressive trimming to deal with the laminitis and we're just like rebuilding that hoof strength, excellent product as well. All instances in which there is some hoof tissue that we want to regrow and repair. So moving on now, breathing difficulties. This is also fairly common in our older horses. We're just going to touch a little bit just to catch you up on equine asthma, or which was previously referred to RAO, hives, or it's essentially an inflammatory response of the lungs. Mostly allergic, not always, but usually is an overreaction to airborne particles, so to particles that are in the air, in the environment around the horse. What's important to know is this, contrary to joint disease, breathing difficulties or equine asthma are not seen in wild horses. So this is actually a modern horse disease. This is something that happens because of the way we manage horses and what we expect from them. So usually it starts as acute asthma, so that can happen at any age really. Sometimes it just hits the horse at a later age. In any case, if this is not managed, the acute crises are not properly managed and the horse is removed from the triggers, it will progress into severe asthma. So this will sensitize the horse's airway, so that exposure to the allergen will sensitize the horse's airway and there will be permanent damage being done. So the airways will stiffen and shrink, so that's why the horse's breathing becomes more difficult, because the airway is less effective at driving oxygen. And this is the form that we most commonly see in horses over 15 years of age. So treatment involves taming down that airway response, that airway crisis, relieving the spasm and clearing the mucus. And this is, for all of these, you need to rely on your vet to provide medication. But there's also something that is really, really important that you do on your side. And the first thing is to detect, diagnose, and treat early. So pay attention to your horse's breathing, to the effort, to the pattern, to how many breaths per minute they do. Normally would be anywhere between 8 and 12 breaths per minute. Also change the environment and reduce that repeat exposure to the triggers that we mentioned. So if your horse has had one asthma crisis, be sure to get on top of that environment change to just help them not to be at risk of developing another one and becoming chronic. And that goes through ventilation, steaming or soaking your hay. That reduces the overall mold and dust in it, so that the horse sticks the nose into the hay net and it doesn't breathe all that dust in. And also support during high-risk periods and rapid reaction if the horse develops a crisis. So we have a range that's called the Balsamic range, which is specifically designed for this type of horses. So Balsamic Control at the bottom would be our pellet, and that's more designed for horses that unfortunately we know that they suffer from this, and that is something that tends to recur one season after the other. So they are really, really well when put on this supplement ahead of the high-risk season and just maintained on it throughout. It just provides that composition is slightly different, but it's more of a rescue remedy. So because it's a very thick syrup, it can be given by mouth directly or mixed in feed, but it has a very strong menthol smell. So it basically helps clear that airway really fast. It's very rated here in the UK amongst horse owners. Both products have a slightly different composition in terms of essential oils, but they are just purely plant extracts. So again, completely doping safe and really easy to use. As a complement to these, and especially because we've been talking about those Cushing's horses that are just not so well on the immune front, having recurrent infections that can also be respiratory infections, we have ImmunoRS, which is a supplement that is designed to support the immune response and the immune function of the horse. So it has pre and probiotics and also a whole cocktail of antioxidant vitamins and minerals to just support that immune function. So it's a really good product to give after vaccinations if the horse tends to sort of become a little bit off color after vaccinations or after worming. It's also really good when the horse has been ill with an infection on the convalescence or recovery period. If the horse has had an intensive treatment with antibiotics as well, to just support that immune system as their own microbia recover, etc. So it's a really good product. I just put it after the respiratory range, but it doesn't really only have a place on the respiratory front, but actually on a much wider set of scenarios, really. And just finally, to wrap it up, we have gastric health. And this is something that we want to promote at all ages. When we talk about the stomach, we know that gastric ulcers affect anywhere from 50 to 90% of horses, depending on which age and activity levels we're looking at. And the main risk factors include reduced roughage intake, so poor access to pasture and definitely turnout. So staying in stall or in box all day doesn't really help. Fasting, intense exercise, and also poor recovery. So too much exercise or too much activity and poor recovery are definitely the main factors. Obviously, this is not going to be so relevant for all the horses, but it's important to know. And if your horse has gastric ulcers, the treatment success relies again on early detection, proper treatment, and compliance with the treatment. So I know sometimes it's difficult, but it tends to be only a month, maximum 2. So it's really worth giving it the best shot. And also diet and lifestyle changes. And this again is where you can do your bit to help your vet and your horse. So ensure access to good pasture. Horses like to be out. Reduce sugar intake and starch intake, because those can upset the stomach because they ferment inside and they produce substances that irritate the stomach from the inside. Keep changes in routine and feed to a minimum, because that also causes stomach upset. Reduce stress and include rest after exercise days. And this doesn't mean if your horse is training a lot, your horse may be old, but you may still be doing a fair amount with him. But just make sure you have at least one full rest day a week. And also if the horse has had a particularly long hack or an intense schooling session, maybe just give them the day off afterwards. And then also we know that supplementing with daily omega-3 fatty acids, a pectin and lecithin complex, which is another type of ingredient, and also active brewer's yeast is also proven to have benefits. And these 3 components are actually in Echigard, which is our supplement for gastric care in horses. So it's just designed to provide additional support for that healthy stomach function. So whether the horse is recovering from gastric ulcers or it has had them in the past, and we know that maybe because it has been stressed, we've changed fields, we've moved yards, etc. It's a high risk period for developing again. So we may just get ahead of it and start on Echigard and just help that gastric function throughout. It has that triple combination of ingredients with the proven benefits. So there was a paper that is very relevant for us vets from the European College of Equine Internal Medicine that basically just certified that the triple combination, it's positive for the health of the horse's stomach. If we go a little bit further down, so we bypass the stomach and we go into the horse's guts, it's also a very important area to take care of. Inflammatory bowel disease is actually the umbrella term that we use to refer to the disease of the different levels of the horse's gut. It's actually the most common cause of mild colic, that colic that sometimes goes on at 3 p.m., but you're not really sure whether to call the vet or not because the horse is not actually that uncomfortable. It may have droppings, but not that well, or they may be those droppings that are a little bit more like cow pat with some water even. Sometimes, not always, but sometimes it's because there is an underlying inflammatory bowel disease. And actually, it can have a significant impact on the horse's welfare and performance. So it's not something to, or it is something actually to consider and discuss with your vet if you're really concerned. Some horses, if this is really becoming an issue, they may lose weight, but they typically present a good appetite. So your vet will check the teeth. They will ask you about the diet just to make sure that obviously you are feeding enough and in a good way, and also on the teeth front that the horse is actually able to chew their food. But if everything is okay and the horse is still losing weight, then we need to rule out worms. And again, if everything is correct on that front, then your vet will start the workup probably for inflammatory bowel disease. So this will mean that even though everything is good, the diet, teeth, no worms, vaccination, etc., the horse is still losing nutrients from the feed or not able to just take them in as much as it should. So the workup is usually quite complex, and it requires ultrasound, the belly tap, etc., which your vet will be obviously very happy to discuss with you about. But again, what can you do? So treat for inflammation and modulate the immune system. This is how we basically have to deal with inflammatory bowel disease, because it's a disorder of the bowel and the response of the bowel. Again, be sure you're on top of your worm control and the worming as needed. So now we know that we need to rely on worm counts and also blood or saliva tests to make sure that we make a good use of our wormers and we don't encourage resistance. And we also know that pre and probiotic supplementation is a really, really good help for these horses to recover when they have inflammatory conditions of the bowel. And also avoid feed and pasture contaminants, because these irritate the gut and they make everything worse. So we actually have a product which is called Boyisac that is really helpful on that front. So it contains active yeast, so that probiotic component, also prebiotic fibers, and it also contains what we call mycosorb A. So that mycosorb A is actually a binder for toxins. So we know that sadly it's almost impossible to ensure that the horse's feed, so the roughage particularly, is going to be free from molds and toxins. That can just happen. But by having that mycotoxin binder in this supplement, we will make sure that those toxins are not absorbed or uptaken into the bloodstream, and they just leave the horse's body in the droppings. So I really, really like this product. I could almost come up with an instance or at every stage of the horse's life where this product may be useful. So if your horse has had a lot of worms and intensive worming and you just want to recuperate that gut after colic surgery, after a bout of diarrhea, after an intense course of antibiotics, because we know they basically wipe out quite a lot of the normal horse's healthy gut microbes. This just helps boost that diversity again. So it's a really, really good product. And finally, just to finish off, we have Equirino, which is a bit of a confusing product, just basically because Equirino may make you think that the product is only suitable for kidney problems, but is actually also suitable for liver problems. So we were talking about those toxins from the mold in the horse's hay or haylage. If these toxins are absorbed into the bloodstream, the first place they reach is the liver. And if they are in a high amount, they may overwhelm the capacity of the liver to detoxify those toxins and get rid of them. And that can be damaging for the liver. So if that has happened, unfortunately to the horse, hopefully the liver has a very good recovery capacity, but we can help that recovery and support the liver function with Equirino, because it has milk thistle, so selemarin, and at a very high dose, and also in the form of a concentrated extract. So it's really potent, so very, very good, that milk thistle on that front. But it also has dandelion and prickly pear, which are two diuretic plant extract that just help the kidney function again to eliminate those toxins also in the horse's urine. So this would be more of a supplement that would be useful if your horse is recovering from an illness, but definitely really worth. Or even if your vet takes a blood test for your horse just for general health, sometimes because they've been exposed to those toxins whenever, they may come back up with increased what we call liver enzymes, or indication of that there's been some sort of liver damage. So this would be a very, very good supplement for that. Thank you very much, everyone, for your attention. And if you have any questions, I think we should have a spare couple of minutes. I hope I didn't go, I didn't take too long. And yeah, happy to answer.
Great. Thanks very much, Marga. Yeah, so if there are any questions, at the bottom of your screen, you've got the Q&A